Hello everyone. Today I, Deekshita Reddy Punari, along with my teammates Aditya Vajja and Hemant Kumar Sunti are going to present about our data analysis project which is on self-medication. So let us know about what is self-medication. So self-medication refers to the practice of self-treatment with the over-the-counter drugs without consulting a healthcare provider or a professional. So reasons for self-medication. There's mainly 4 points. So I'll talk about first point, accessibility. OTC drugs are widely available in pharmacies and online platforms, thus making them accessible without the need of a prescription or a physician. Second, cost. People are in a state of mind that consulting a doctor can be expensive, especially for the individual without health insurance. Because of this, that cost may be a reason for opting the self-medication. Third point, convenience. It allows individual to address minor health issues quickly without the need to schedule an appointment. Experience. Individual may feel confident in their ability to self-diagnose and treat common seasonal health problems based on their past experience. Example, COVID-19. Coming to the main objective of our project, it is to understand perception and attitude of 18 to 28 age groups about self-medication regarding its usage and significance. The process to do any kind of analysis, there are 5 steps to be followed. One is to create data, and next processing data, later analysis, and then preserve data and give access to the data.
Coming to the data collection, we have done an online survey among the population. We have sent a Google form questionnaires to the people containing of 15 questions regarding the awareness of the self-medications, and the demographic factors which we choose are like name, age and gender of the population. A total of 57 responses during our survey. We transferred this data to a data sheet and checked for are there any duplicate entries and missing data during the collection. Coming to the data interpretation, like I said earlier, we have taken demographic factors like age and gender during our analysis. Based on these factors, we have created some of the graphs for our questionnaires. The first one coming was like, are OTC drugs better option compared to the obtaining prescribed medications from the doctors? In this, if you see in the graph, most of the female population strongly disagree to this compared to the males who are mostly neutral. Are the OTC drugs are safe? Here also you can see the mostly female population are strongly disagreeing to the statement compared to the males who are neutral. While coming to the next one, consuming OTC drugs according to the recommended doses, you can see most of the population are telling that they strongly agree with this statement. Of the drugs, most of the population are telling that they consider a brand and pharmaceutical company while selecting a drug uh, compared to the price. The other regions, some of the people stated like suggestion from the payers, pharmacists, or doctors. Pareto and radar chart, which are done based upon the results we obtained from the survey. The most important part of our survey, what do you think about self-medication for self-health care? In this, we have given is self-medication is an acceptable, good or not acceptable practice. The most of the males told it is a good and acceptable practice compared to the females. Among females, they had a biased statement like 16 of the total female population told it is a not acceptable, while 17 of them told it is an acceptable and good practice. And among all the overall population, most of the people states that it is an acceptable and good practice.
Finally, we are at the conclusion part. So, from the data analysis that has been carried out earlier, the result states that self medication is most acceptable and good practice among the surveyed population. In the context of increasing self medication practices, there is an urgency need for administrative agencies to frame and implement laws to limit the purchase of OTC drugs. Further, designing of effective tools and guidelines to monitor the selling of medications at the community level pharmacies and improving the knowledge and attitudes of pharmacists are also recommended to promote responsible self-medication within the country. Consensus that we have carried out. Thank you so much for watching the video.